Hey, everybody. Glad we could get back together. It's been almost 6 weeks since we put that first blog piece out. And as I was thinking about this conversation today, we were in COVID mode, for lack of a better word, for 2 or 3 weeks before we even got together and wrote the blog, the first one. I've had a couple of those since, and Patrick's helped us out with some video content. Uh, I just thought it might be nice to get back together and check in a little bit. We all have been working with our clients and partners across the state and across the country. They're all experiencing this crisis and this situation differently, right? We've talked about this. I mean, some of them have stayed open throughout and are right on the front lines of things. Some have had to shut down for any number of reasons. Some have been more in flux. I suspect that's true for all of us too, right? Depending on who those clients are and what sorts of projects we were working on with them. Let's just check in for a second. How's everybody doing? Welcome back. I'm glad to be with you all.
It's so great to be with all of you this morning, taking a break from homeschooling duties. I'm just crossing my fingers that little people don't come into the shot at some point, but if they do, now you know what to expect. But so glad to be back with all of you. I've really enjoyed our work together over the last several weeks.
Doing well. Good to see you all and great to be with you. I'm good and getting better, excited about the opportunities ahead. We are pushing through and getting through. Clients, partners, the community are coming together. And as always, I'm just glad to be around the energy of this team.
Yeah, I'll ditto that. And I'll also thank both Casey and Forrest for your leadership in kind of holding these conversations. But yeah, I think we're all as busy as ever right now, which is kind of strange. I'm looking forward to the conversation.
Good morning. I would agree with Patrick. Busier than all get out. And there hasn't been a slow moment in the last 6 weeks or so. But it's really good to see all of you. I'm glad everybody is staying safe and staying well. And I'm looking forward to this time with you today.
Charles, you used the term just now, good and getting better.
Yes.
I'm glad to hear it. I've also heard you use the term over the last couple of days, exhausted.
Yes.
You and I are both in this same place. I think that's probably true for all of us by some definition, right? I mean, this has been a long journey we've been on here. I mean, what can people be doing, especially, executive directors or CEOs and their boards? What can people be doing right now to keep up that energy level and keep charging ahead?
Forrest, it's interesting. I'm an old school person, as you know, and I grew up with my parents listening to Bill Withers. I don't know if y'all know who Bill Withers is, but he had a song, Lean on Me. And some of you remember the movie and the song. And if there were a theme song for nonprofit EDs and boards right now, it's Bill Withers' Lean on Me, because that's what I see them doing. I see them leaning on each other, relying on each other, engaging each other. During this time, I am seeing boards and CEOs come together and bond like I have never seen before. I mean, they really are counting on each other, holding each other up, and creating that space where they are also saying we're exhausted, but we are pushing through. And I'll tell you something interesting as well, Forrest. What we're finding is it's actually more efficient now. And here's what I mean by that. What a lot of boards and EDs are finding is not the work that's exhausting, it's the uncertainty that's exhausting. It's the waiting that's exhausting. And what they're doing to deal with that is they're doing some action. They have some micro wins, as we call them. In other words, they're not trying to figure out what's going to happen in the next year, what's going to happen in the next week, in the next day, in the next 3 days. And those small wins are giving them the energy to keep going.
Patrick, you're the leadership coach among us, right? I mean, this sounds like something I heard in the video you did with Madeline just a little while ago about shared leadership, right? This sort of sharing the burden. I mean, what am I hearing that correctly in what Charles is saying? I mean, what's this look like from your perspective?
Yeah, I loved Madeline's answer on shared leadership. But before I get to that, I want to chime in. What Charles said when you said the word exhausted, I was coaching a client yesterday. One of the first things she said to me when I said, "So how's it going?" Her word was, "It's exhausting." And then the next thing she said was, "I feel like things like we can't move fast enough." We spent the next 5 minutes or so unpacking what all they've actually done in a 2-month period. And she was blown away. Like, wow, okay, wait a minute. We have done a lot of things. We've implemented things that would have, pre-COVID days would have taken us 2 years to, committees and task force and thinking it out. And when she actually thought about everything that she had done, she went, no wonder I'm exhausted. And it dawned on me that in a sort of macro way, we're running on adrenaline, like a 2-month adrenaline. And it's wearing down. It's getting tough now to stay in that adrenaline mode. So Charles, you're that comment really resonated with me. And the shared leadership piece is one way to help with that stress and that exhaustion. And that I won't spend a lot of time on it, just to say that shared leadership means I don't have to do everything. Now's the time to delegate, not tasks, but opportunities. Give my staff a chance to do something valuable and meaningful right now. Ask my board chair specifically for something that they can do to help. Most engagement happens when people are specifically asked to do something, and it's trust building and people feel valued, and you're sharing that leadership. So I think it's a good mitigation tool.
Casey, it makes me think about some of the things you and I have talked about related to communications. And I know you've written about this. It was part of both of our blog posts. I mean, some of this is internal communication, obviously, between the director and the board and the staff and those sort of things. It's also external, right? I mean, I'm not sure that it's necessarily appropriate to send out the newsletter from the CEO that says, hey, everybody, we're exhausted. But I understand, in Patrick's point, it's also important for us to be vulnerable and communicate these things. I mean, what does communication look like right now? We've been sort of on hold and maybe don't want to push out a bunch of messages. Maybe we do. Now things are moving along. What's communication look like in this time?
I think we're still in paying attention mode, ensuring you're not tone deaf mode. For some, yes, they are still in the middle of this crisis. They are still on the front lines. They are still trying to make it day to day. They are exhausted, as Patrick just described. But for others, their organizations haven't been as intimately impacted, so they're not sure when to chime in, when to create messaging, when to start pushing things out. But I think it's just paying attention. And are we being a part of the conversations? How are we messaging to our donors, our supporters, that yes, we too, even though we may not be on the front lines, we need that support still. Just this week was Midlands Gives in South Carolina, where nonprofits are able to message to donors around one particular day. And it was a record-breaking year this year for Midlands Gives, which I think speaks a ton to the community and where they are and how we're all ready to jump in and help nonprofits. But I think about organizations who aren't on the front lines per se, and I'm thinking about the messaging that I saw from them for Midlands Gives, or even a few days before, like Riverbank Zoo. They are being heavily impacted by this because this is their peak season. They would normally have tour bus after tour bus of field trips coming in during March and April and May. So that has really hurt their budget and their bottom line. Same thing with the Newberry Opera House in Newberry, which is where I live. They're not on the front lines again, but we're going to want these places there when this is over to bring enjoyment, to bring joy. So they need to remain a part of the conversation. And I think I saw some great messaging around that this week, and really telling donors how this is impacting them, staying a part of conversations, and reaching out and helping those that are on the front lines when they can. I don't think they need to be radio silent. I don't think that's where we are anymore. But I think you need to pay attention and you need to be a part of meaningful conversations.
I really love pay attention, right? I mean, it's probably true for all of us all the time. Tom, it's interesting. I mean, you and I have had some conversations. I think it's what I love about this group. Sometimes all five of us get together. Sometimes it's different dyads and triads. But what has happened for all of us on this call over the last 6 or 8 weeks is a a real connection, a tighter bond amongst ourselves. Speaking of challenges, Casey just mentioned, communication is complicated. She mentioned fundraising. There's lots of other challenges out there. I'm going to put you on the spot, Tom. What's the biggest challenge right now that nonprofits are facing as we start these conversations about perhaps reopening, depending on what state or city you're in?
Well, I think for the nonprofits that I work with, and I'm actually thinking about a large agency that I work with, and where this really comes through in a very significant way, this balance between compassion and need. So on the compassion side of things, what we have, for example, is a study that came out from Harvard on April 30th. And they looked at 23,000 Americans in all 50 states, and what they found were that 93% of Americans are saying it's too early to reopen. We're scared to go back. We don't know what this will mean for us to actually go back into the workplace. That is a staggering number. And at the same time, the other side of that tension is that the nonprofit leaders are feeling like we've got to get back to business. We really need to be engaging our clients, engaging and doing the work that we do. And so how do we really balance that tension of really caring for our folks, making sure they feel safe, making sure they're comfortable coming to work, and at the same time doing what we need to do to really effectively see our organization go forward. So one of my clients is actually thinking about doing this. They have about 350 employees. Their central office building, or one of two main office buildings, was built in the 1970s, and so it's like cubicle city in there, right? And social distancing is almost an impossibility. But their staff are saying, well, wait a minute, we're not sure we want to come back into this old building and risk the possibility of exposure. So among the solutions they're examining right now are, can we have half the workforce come in for 1 week and the other half stay at home, and then flip that? How do we maintain the social distancing part or the physical distancing part so that people can feel safe? How do we just simply restructure how we do our work to make sure that we're striking that balance so that we can go forward, address the needs, move the organization forward, and let people feel like they're taken care of and feeling safe? I think that's a huge challenge.
Yeah, I don't disagree with that at all. And that specific piece, right? Social distancing and what comes along with that, and paying attention to data trends and listening to our governors and our leaders, that piece is very unique to the COVID situation we're in, right? That's new territory. But what's really interesting though is a lot of the other stuff we're talking about related to leadership and just good management practices. One of the real aha moments for me has been, we've all been racking our brains about what does leadership look like in this moment, and have come up with, I have a biased opinion, but what I would say are some pretty good tips and interesting thoughts. But the aha moments for us have all been in our video series with Patrick. Nearly every video we come back to, the more I think about it, we should have been doing this pre-COVID. And yes, we should be doing this during COVID. And yes, we should be doing it after, right? So, Patrick, everything Tom just laid out about the social distancing piece and reopening is very COVID specific. But wouldn't you agree that it's also true a lot of the things we've been talking about are maybe not all that COVID specific and more just good practice?
Aside from those specifics about reopening, I'm actually not able to think of any of the sort of tips and conversations that we've been having that don't apply to just any. It's really interesting. You came on, Forrest, and talked about looking at our mission and making sure that we're prioritizing action around our mission right now. That's not a crisis leadership technique. That's a leadership technique. Casey talked about communicate. You can't over communicate, be transparent. That's not a crisis communication tip. That's a communication tip. Tom talked about self-care. We have to care for ourselves before we can care for others. Not a crisis tip. That's a leadership tip. Charles talked about boards trusting and supporting their CEOs. Not a crisis. So the last time we had this conversation about this, Forrest, forgive me, but I came up with a really cheesy analogy that I think might make the case. And that is that while all these leadership tenets that we're talking about are universal, the stakes are higher now. And what I thought about was, I'm a child of the 80s, graduated high school in the 80s. So I remember the Karate Kid movies, right? And Daniel in his first, and if you haven't seen the movies, shame on you. But you'll have to go see it now to get this comment. Daniel, he's bullied by his friends or his schoolmates, and he ends up, challenging them in a tournament to put it all to rest. He takes on this Mr. Miyagi, the maintenance man, as his mentor. Miyagi teaches him the family karate. Daniel wins the tournament, all is well. In the sequel, they go to Okinawa, and Daniel is challenged to a fight to the death. And Miyagi looks at him just before they're about to fight and says, Daniel-san, this not tournament, this for real. And that's what it made. The karate's the same. You need to do the same kicks and punches and blocks that I taught you, the same ones you did in the tournament. It's just that the stakes are higher now. To me, that analogy kind of paints it out. We're in a moment where these things really, really matter, not just right now, but they've got implications for the long term. So what I'm coaching leaders is there's a lot we're learning that we didn't have in terms of leadership competencies, maybe partnerships, influence, maybe, board engagement and those kinds of things. And it's being illuminated. And my take would be, don't beat yourself up over it, but learn from it. I think journaling right now is really important about what we're learning and what we can carry through so that the next crisis, and there will be one, these things are more developed. So a lot of what we're talking about are things that develop over time, and right now sort of tests how well we've got them developed, but the stakes are high.
Yeah, they are. And I'm smiling, Patrick, and probably Tom is too. 10, 12 years ago, maybe, when I was at the South Carolina Campaign to Prevent Teen Pregnancy, we were doing some leadership training for our senior leadership team. And Tom connected me to somebody who's now a mutual colleague of ours, Mike Wagner from Iowa, who was going to do this leadership training for us. And I remember in my initial conversations with Mike, much like any of us, have initial conversations with our client, I said, Mike, what do we need to do to get ready for this leadership training? And he sent me back a note and said, I need you to buy several copies of Karate Kid and distribute it to the staff to watch. And I remember sending a note to Tom and saying, what have you done? Like, who is this guy you've hooked us up with? So I can attest, Patrick, that I've gone through an entire leadership training based on Karate Kid 1. That's a conversation for a different day.
Let me give you another one that we used in a formal leadership program. We actually viewed the entire film. I refer a lot to Apollo 13, the movie Apollo 13. It's not a documentary, but it's really close. It's very accurate. I've actually had the opportunity to talk to Jim Lovell about the movie and its accuracy. And it's a masterclass in crisis leadership. And I would just say the biggest gem that I get out of it every time I think about a crisis is when the flight commander, Gene Kranz, after the ship's oxygen tank has exploded and they're in trouble, Gene Kranz says, what do we have on the spacecraft that's good? And let's deal with this from a position of status. And so I really do think asset thinking right now is really important to what we're doing.
If I could, I want to go back for just a second in terms of this idea that we were talking about. So much of what we need to do is what we already have been doing at one level or another. I so completely agree with that. The one thing I want to be very careful of, though, is that we don't suggest to people that this is not an absolutely incredibly novel situation. That we get that part, that none of us have ever been there before. I mean, unless we're like over 100 years old and we went through the Spanish flu epidemic, and I don't think any of us are that old, and I'm the oldest of the group. Unless we've been through that, we've been through nothing since that time compared to what we're going through right now. It's now comparing to the Great Depression in terms of unemployment. It's now comparing to the Spanish flu and perhaps worse in terms of epidemic. what I think is what we're trying to say here is don't forget what you already know how to do, and to not be afraid to think all of a sudden that because everything is new, that I don't know what to do. I don't have the tools. And I loved what Patrick said about really building on the assets. The fact is that you do have the tools. They're there. And sometimes we have to take a step back and say, okay, so what are the tools we need to use here? And so I think that's, at least as I hear this, I think that's what we're trying to say.
Yeah, I think that's exactly right, Tom. And using the tools and the assets we have, and or back to some of these shared concepts, finding the people in our circle who do have them, right, and bringing them in closer. I really resonate with this. The stakes are higher part that Patrick was mentioning. My old baseball coach used to say pressure bust pipes. And I mean, the stakes are higher here. The lights are brighter. The decisions all matter, but so many of the tools that we have in our toolbox are the same if we remember to use them. Charles, it makes me think about something you had on social media a couple days ago. We all follow each other and interact with each other and learn from each other. You had a post the other day that highlighted 3 words: imagination, courage, and authenticity. Short of Patrick and I getting our imagination going about recreating Karate Kid or Apollo 13 movies as part of our learning. I mean, imagination, courage, authenticity. That post really struck me. I'm wondering how you got there and why you were pushing out those 3 words.
Forrest, speaking with EDs and others over the past couple of weeks, those 3 words kept coming up in those conversations. Talking with board chairs and board meetings, those 3 words just kept coming up over and over and over again. And one of the things that I realized is imagination, and authenticity, and the things that we're talking about right now are so important to the work that we are doing, and courage. And so as an example, think about this, the word imagine. Just hearing that word kind of opens our mind up. Just to hear the word imagine makes the mind just on its own, it just kind of opens up, imagine. And we really need right now some creative things to take place. So imagination fuels creativity. Courage, I believe, fuels action, okay? And authenticity fuels trust. So if there was ever a time where we need boards and EDs to imagine possibilities, to have courage when they act, and really be authentic in their actions, it is right now. I don't know if any of you realize this, but many parts of our world and our country right now are what I would call a low trust environment. And people right now are begging for leadership. People are yearning for direction. People want to know that when you say what you're saying, I can believe you, I can trust you, I can follow you. And one thing that I don't think nonprofits get a lot of credit for, the leadership that nonprofits bring to communities is unparalleled. I think in the midst of COVID right now, we've seen businesses shut down, we've seen government agencies shut down, and everybody's doing the best they can. But we don't give nonprofits enough credit for it. They're on the front line still. They're still open. They're still working. They're feeding, they're clothing, they're tending to, they're caring for. And nonprofits, in my opinion, are pillars in communities, and we need to lead them with imagination and courage and trust to keep driving this change going forward. So I think it can work. And we got to recognize that we, on the line of nonprofits, let's use our imagination. Let's keep being authentic, be who we're supposed to be. And let's operate with courage, because the decisions we need to make aren't easy, but we've got to make them for the greater good.
Man, that's powerful. And I will say the part of that I think I love the most, although they're pretty equal, is the imagination part. And what strikes me is that one of the things I learned about creativity a long time ago that I try to share with my clients is there's more than one right answer. That creativity is not, here's the problem, we have to find the solution. There's one solution out there somewhere. We got to figure it out and find it. That's actually counter to creativity. So, and imagination. So imagining what's possible means, what if we did this? What if that? Well, what if this? And maybe this would work. And so I really love it. And I saw when you posted it the other day, Charles, on your group page, those 3 statements, I did just, it was loud and clear. It rang really true.
Well, that's really got my creative juices going now, talking about imagination here. And actually it really dovetails into something I've been thinking about this, which is that not only do our leaders and our leadership need to be really imaginative and creative, but we also need to open space for innovation to really emerge in our organizations as well. And so I think, this idea of emergence, what does that basically means? It means kind of clearing the space where the imagination can begin to flow and to allow others to step forward with that. In our organizations, we have a lot of different people. And it's not just completely upon the board or the executive director or the senior leadership to really have all the imagination juices. Those may exist at other levels of our organization that we don't regularly engage with. And so we can do some things very strategically and very purposefully to really tap into some of that imagination and innovation that is there. We can do appreciative inquiry. We can do an appreciative summit with our entire organization if we want. We can look at a framework like the Foresight model out of Australia. Hindsight, oversight, foresight, and I think I forgot the last one of it. Insight. Thank you. Heck, they all had the same ending. It's just anyway. But the foresight model is one of those that's out there that gives us a framework for how we really think about what it means to be imaginative and to create the space for innovation to emerge. And of course, as it emerges, then we have to feel comfortable, doing rapid prototyping with the ideas to see what works best. And Patrick referred to this somewhat as well, that we have to become comfortable with good enough. We're not going to it's not going to be possible for us to do something in our very best way. To make it perfect. And so let's go for, is it good enough for this moment? Because we always have the opportunity to improve it. We can always make it better, and we can reach our best, but it doesn't have to be our best to begin with, especially in a moment of crisis like this. So thanks to Charles for introducing this whole idea of imagination and creativity, because this is really what is needed by all of us right now, is because we don't know the future. We don't know what's coming at us. So we can only imagine what it might be and then think of creative ways to address it.
Forrest, can I jump in there real quick? Just Tom said something that just made me think of something. As you know, I'm a veteran, Air Force veteran, and it brought a military term back to mind for me. A military term, it's an acronym, OODA, O-O-D-A. Some of you know this term. Observe, Orient, Decide, Act. Observe, Orient, Decide, Act. Particularly used by fighter pilots and others who are operating, obviously, at supersonic speeds. They have to observe, orient, decide, act. Observe what's going on, orient, where do I sit in position to what's going on, make a decision, and then act upon it, and then repeat that cycle over and over again. I see nonprofits doing that right now. With imagination, I'm observing, orienting, deciding, and acting. And what we know right now, the speed of decisions are increasing, and I'm telling folks this, it's better to make the wrong decision and correct it than to make no decision. Because that no decision can then, again, it exhausts people, it drains people, and quite frankly, it can bring people to question your leadership's credibility.
Yeah, Charles, I love it. I really do. I also want to go back to that imagination list. One of the words that's really sticking out to me, and I hadn't thought about using this word in this context before, is courage. And I think about the first blog piece that we all put out together, right? And we had this circle image of caring for self and family and organization and community. And, perhaps one of the unique things, to go back to that idea about this situation, is the layering effect, right? I mean, one of the things I've been struck with as we're interacting with folks is how much people are balancing live in the moment. You know, you've got directors of their own organizations who may also sit on the boards of 2 other organizations who now all of a sudden have a few kids at home, and they're also their teacher, and they're trying to protect elderly parents, and they're worried about their neighbors, right? The layering piece of this is amazing. And like I said, I hadn't used the word courage in this sense before, and I'm going to call out my colleague and friend. She'll be embarrassed for me doing this, but Casey, the word courage and what you're balancing yourself comes to mind right now. I mean, you know, we're still humming away on 1,000 feathers. You had to go virtual as a professor at Newberry College. You have a family, 4 little people at home all the time. It's been amazing sort of just watching you not just survive, but thrive through these moments. I mean, take us behind the curtain a little bit. What does this look like as a mom right now?
Ooh, I'm surprised you used the word thrive. Thank you. It does feel much more like a survival mode. I think it's as messy as you all think it might be. I'm shocked that, as I said at the beginning, that no little person has come in here during this video. I mean, I've literally had to lock myself in my bedroom to try to get any work done over the last 6 weeks, but I don't know if I would use the word courage. There's so many other people that are doing so many harder things right now than I am. So I try to always put it into perspective, but it's definitely been challenging. And early on in the first few weeks, I literally didn't know if I would make it out to the other side. It was, you know, transitioning from just work to transitioning to working in the house. Yes, taking my class virtual, which was hard enough for my college students, and then doing this homeschool thing. And I have 4 children, so it wasn't just I'm homeschooling a 17-year-old who can do his own thing. I have a 10-year-old, a 6-year-old, and 2 3-year-olds. And so it's been a whole different ballgame with a lot of different challenges that I've never faced before. But I had this conversation, Forrest, with you earlier this week. I think I'm experiencing things that others experience often, right? Without a support system. I have been blessed to have my parents and my in-laws who live right around the corner. Well, my mother-in-law is a nurse, so she hasn't been able to be around my children. And my parents are older and don't want to risk being around my children and us either. And so I've had 0 support from them over the past 6 weeks. And I have really felt that. And I knew I was blessed to have all of that in my life, but when it's taken away, you really see what a support system does for you. And without that support, it's been exponentially harder. So the kids never leave the house, nor have I been able to get out and actually go to my office. So it's been hard to transition into, I can work 30 minutes here, and then, okay, a few hours later, I can work another 30 minutes. It's just a totally different work environment. And so I think as nonprofit leaders, we need to understand what our employees are facing. And that's just the reality that we're facing when we're trying to work from home with little people running around. And I mean, right before I got on the call, I'm putting together Lego sets and running school before I ran in here to jump on this call. And so it's just a balancing act that none of us have ever had to really do before. But I love, Forrest, how you said right back at the beginning of this, you had these 4 children before, but now it's like in everyone's face that we're all dealing with all of these different things. And I think one good thing that has come out of this is the grace that we are all showing one another. And I've seen that through our clients. Forrest, I've seen that with you. Thank you. I mean, there's just been a lot of grace for all of us who are trying to balance things that we've never had to do before.
It's another good word, right? We've come up with a whole list of words and themes and topics here. Patrick, I'm struck as I'm listening to Casey. You and I were on a call recently with 100 CEOs from across the state of South Carolina talking about, you know, I'm still using quotes here whenever I say reopening because it means such a different thing to different people. I mean, a lot of what came up on that call were things about safety, right? And concerns for bringing our staff back, and concerns for bringing volunteers back. And what does it mean for our staff that don't have childcare? You know, especially with kids not in school, all those sorts of things. I mean, we chatted a little bit after that call was over, and I was struck by some of your observations. I'm going to put you on the spot. What'd you think of that call? What'd we learn?
We learned that we really don't have a single guide to tell us what we need to do next. We broke into Zoom breakout groups with these CEOs, and in every conversation, it was all over the place. I mean, when you ask nonprofit leaders, what's your plan for reopening? It was everything from we never closed to late June to we're going to use the AB schedule that Tom talked about a little while ago and start rotating our staff. I mean, it was all over the place. Safety questions were all over the place. And the idea, you know, Forrest, you shared some data on the call, some data from DHEC, our state's health department, about the curve and what's happening. But you referred to the conflicting standards that we're trying to use to reopen, you know, 14 days of decline in cases versus a trend line over 14 days of the percentage of tests that are positive is decline. You know, there's, well, who do you listen to? The White House guidelines. I mean, a lot of people I talk to think, yeah, those make pretty good sense, but the states are, you know, some are following, some of them are not, just totally ignoring them maybe, because then we have our governors and their own guidelines for reopening that we have to listen to. Even mayors of cities are doing kind of their own thing sometimes in terms of policy. Some of our nonprofits have national organizations that they sort of report back up to. They've got guidelines and policies. Boards are seeing things differently. And then there was the really interesting concept that somebody brought up that, hey, we can follow guidelines all we want, but if our volunteers aren't ready to come back, if our employees don't feel safe coming back, guideline, schmideline, you know, what do you do? And so I wrote down actually some of the top points, and I'll go through them real quickly. I wrote down some of the top points I got out of yesterday. Number one, I just mentioned multiple decision points, data points that we've got to pay attention to make a decision. Second, that this varies by CEO, by nonprofit. It's not a one size fits all reopening, just like the country isn't. Third, this is a positive thing. We're learning, I think, that we can move fast when we need to. I referenced it earlier. We're all talking to people who have done things in the last 2 months that would have taken 2 years at least to do before. So when we need to, we can create speed. What are the implications of that? Charles and I talked about the trust formula about, you know, high trust equals fast speed and low cost. You know, are we trusting more now because we have to? That was a question I had. Another one, liability. I mean, we've got questions about, okay, so we don't reopen according to guidelines, and employees, will we get sued because we haven't followed the guidelines and reopened and now we don't have a job? Or what if we do reopen and I don't want to come back to work yet? You know, or what about I come back to work, I get COVID-19 because maybe the safety guidelines weren't followed. You know, is litigation going to be a big deal? I think we're all wondering those things. The fifth thing is that we're realizing we might not need all the physical space we've been using. We've had this conversations come up many times, organizations going, hey, you know, we might not move back into our physical space ever because we're learning what we can do remotely. And then finally, the idea, and this came up yesterday too, the idea of this balancing act, this tension, Tom mentioned it, you know, and we kind of, the best way we can categorize it is health or the economy, health and safety or the economy. I'm not so sure those are mutually exclusive terms, because I think what we're not looking at a lot anyway, while we're looking at all the flattening of the curve and everything, is what's happening to the suicide rate. I don't know I know that several of us are working with a number of domestic violence clients, and they are telling me spike, like child abuse. I'm hearing, I was talking with some, I mean, the cases are worse in some cases. They're going to have lag indicators and have a wave later. Poverty causes sickness. mental health problems that are going to come out of this. A lot of that data we won't know for a long time. I walked out of the call yesterday, Forrest, always inspired that there are some incredible minds and leaders out there. It's always such a good feeling when we meet with them, but also an acknowledgement that we're still in the mode of having more questions than we do answers.
Yeah, I remember vividly from the first blog we did, we wrote the words, "There's more than one path forward," right? And that was true 6 weeks ago. It's still true today. And everything you just said, there's all these questions circling. There's no uniform guide, right? There are lots of different guides floating around there, and different people have different thoughts and different opinions. But it's also true, Tom, and you and I have talked about this, that by any measurable definition, we can't just hunker down and wait for this thing to quote unquote go away. Right? I mean, there are varying interpretations of, will there be a spike, or has the curve been flattened, or when's it going to decrease, or those sort of things. But this isn't anymore. I think all of us are coming to the realization that it's not just going to disappear. Right? So Tom, I'm directing this at you, but I want to hear everybody's thoughts on this. Given all these challenges that are circling, what's the most important thing? Give me one thing leaders and organizations can do in this moment as they move forward into the next 6 or 8 weeks.
Really good question, Forrest. And I think that I'm going to go back to something that I heard earlier, and from Casey and from Charles and Patrick, around this idea of courage. I think that in this moment, the leaders of our nonprofit organizations we work with, nonprofit leaders across this country, really need to have courage to do what they know that they need to do for their organization in this moment, regardless of what anybody else is doing out there. Guidelines are great. Information is always very, very useful. We have to process it. We have to think about it. But ultimately, what it comes down to is that we have to make those decisions to do what we know is best for our organization and right for our clients and right for our staff. And that is going to take incredible moral courage to do that, because we're getting pressure from all different places. We're getting pressure from people that say, "Oh no, it's okay. Let's go out in public. No masks are needed. It's my body, my mask, my choice." All of that kind of stuff. We're getting pressure from people that are saying, "No. You can't even go outside without, practically a respirator mask, right?" So there is this balance that we have to strike. But knowing what that balance is and acting upon that is going to be the decision of every nonprofit leader and their organizations. It may not be popular, but it needs to be the right thing that you do for your organization in this moment.
Tom, I completely agree with you. And back to what Patrick said, there is no one size fits all. I think that is the big headline here. There isn't like, this is what every single nonprofit needs to do. And I would encourage nonprofit leaders to talk to your staff. Listen to them. What are their concerns? What are they willing to do? What does their home look like right now? Like, it's not back to normal for those of us with young children at home until we're not at home with young children. So until childcare is opened up, or summer camps, which don't seem to go, I don't think those are going to happen, till our grandparents feel comfortable stepping back in, until they go back to school in the fall. This is not normal. And so as much as we want to get back to opening businesses, like, you just have to realize we're in different times. This is not normal for your employees. And I would really encourage leaders to reach out to their employees and really start listening to them.
Casey, it's a really important distinction, isn't it? As I'm hearing Tom and then you talk, both are correct, right? I mean, Tom encouraging people to show courage, but don't mistake courage for meaning you need to lock yourself in your office and make all these decisions yourself, right? That is not what courage means, right? We can make courageous and bold decisions and listen to and absorb and take in the input of our staff and our board and those in our inner circle. Charles, what would you add here? One thing.
One thing that I would add, excuse me, I think nonprofit board and leaders need to make values-based decisions. If we do anything right now, we have to make values-based decisions. Excuse me. Those values that you have on your website, on the wall, on your business card, or in your board manual, now's the time to look at those things and say, are they really real? Are they just nice words, or are we really going to practice these right now? Because this is the time where, as we're being nimble and being flexible, and we're practicing all these different things, resiliency and so on, our values should guide everything we do. And tough decisions guided by values must be made.
Patrick?
Yeah, I don't think I would add anything. I think I would reiterate something because it's what keeps churning back in my head as I listen to all of you. And it goes back to something Charles said on his interview with me a few weeks ago, and it got a lot of response from people that watched it. And that is, it's time for CEOs to show boards why they hired them. And so I want to mix that comment with everyone's comments about courage. And I want to refer to something that impressed me on the call yesterday that we talked about, Forrest, with 100 nonprofit CEOs in South Carolina. One of the nonprofit leaders, and I won't call them out by name, said, "Our board never voted to close. I closed us." It was not a time when we had, board meets the second Thursday of next month. When we get a chance, we'll ask them about should we close or not. It wasn't time for that. Board members were distracted. There was already, now the caveat is there was already established that high level of board trust in CEO that Charles talks about. So, I don't advise this for everybody. If you don't have that culture of trust, that can get into troublesome ground. But it just impressed me that here was a CEO saying, hey, right now I got to lead, and, forgiveness over permission right now. It's not that she wasn't engaging her board. I know that she is. It's that CEOs are having to make those judgment calls based on courage, based on value. I mean, just really everything you all have already said. But that decision struck me, right or wrong. You might argue whether that was a good thing or a bad thing, but it pointed out that here was a CEO going, we can't wait. We can't put this in a task force for the next 2 months.
Yeah, I think that's right. And I would just add one final thought. And it really is personal for me as a result of this group and otherwise. And that is for people in this moment to keep learning, right? I mean, I have valued so much these conversations that we continue to have, whether they're on Zoom together or the occasional text message back and forth or picking up the phone and calling each other. I've learned so much from all of you in the last 6 or 8 weeks. And I think that's true for everybody in this moment. Again, that CEO call that just happened, putting people in a room together and allowing them to think and interact and learn from each other. We do have tools in our bag that we have to use. We all have to commit to applying what we know now, right? Using the tools we have. But we all have to also commit to striving to find more answers over time, to keep learning, to keep sharing, to keep interacting. It's the reason I love this group so much. So thanks again for getting back together, and I can't wait till the next time.
Thanks to you again, Forrest, for keeping it going and sort of hosting and keeping the conversation headed in the right path. Who knows what else is going to come out of it, but I know we're still in touch and learning and communicating what we learn along the way. Appreciate all of you.
Likewise. Thank you all.
Thank you all.
Thanks.